Well, hello and welcome. My name is JJ Kravit, Vice President of FHK Insurance. And on behalf of your agency and your agent, we want to thank you for taking the time to watch this insurance review. For today, our goal is to go over your benefits for next year, review any changes, and hopefully provide some peace of mind. We are thrilled to show this to you, so let's get right into it. Today we're going to talk about Network Health's plans for next year, but first we have some exciting information we want to share. Network Health, which is now owned 100% by Froedtert, has added Pro Healthcare to the network as of October 1st. So that gives you in-network access to Froedtert, Ascension, and Pro Healthcare. For those of you using Aurora, Network Health has a great plan option for you next year. So let's start by going over the Go plan, Network Health's most popular program. So next year, the good news is there's no major changes. Your premium is remaining at zero. Your maximum out of pocket remains at $3,900, which is lower than most other PPO plans. Inpatient hospitalization remains the same. It's a $295 copay per day, days 1 through 6. Your primary care physician, zero copay. And specialist copay is still only $35. Emergency room, $110 copay. Urgent care, $45. And just a reminder, you have worldwide coverage. If you're ever out of the area and not feeling well, just get yourself to the nearest facility and you will be covered. As far as lab services and x-rays, no changes for next year. And diagnostic radiology services, like your MRI, CT scans, it's going down to a $200 copay. So please feel free to take a moment and pause this slide if you want to before we move on. So let's talk about some extras. Remember, with Network Health, you get a routine hearing exam every year. And for those of you that read better than you hear, Network Health does offer coverage for hearing aids through True Hearing. In addition to that, you also get a routine eye exam for $10. What's nice about that is Medicare does not cover either of these benefits, but Network Health does. So hopefully you're taking advantage of that. Now, Silver Sneakers will continue to be included in your plan for no additional charge. And just a reminder, this is a fitness membership to many local participating gyms. To find out if your gym participates, visit silversneakers.com. Pick your perks, Network Health's most unique benefit, and hopefully something you've been taking advantage of. So let's take a moment to discuss. Pick Your Perks is a reimbursement program for items and services not covered by Medicare. How I like to describe it is it's like a bucket with $1,525 in it. And what's unique about it is that Network Health lets you use that money how you want to. You can see any dentist and get reimbursed. You pay the bill and submit a receipt to Network Health or Patricia at our office, and you will get reimbursed dollar for dollar up to $1,525. Now, if you don't have that much going on in dental services, maybe you want to use it for a new pair of glasses. Well, in 2023, they limited that eyeglass reimbursement to $200. In 2024, they have removed the limit. So Gucci sunglasses are back on the table. Need a ride to a doctor's appointment? You can coordinate a ride with Arrive Transportation Services. There's an acupuncture and massage benefit for those with chronic pain. And lastly, we like to advise our clients that if there's any money left over, you can buy over-the-counter items to maximize that $1,525. So we hope you're utilizing this fantastic benefit. As a friendly reminder, receipts do need to be submitted within 120 days of purchase to be eligible for reimbursement. So if you have any receipts laying around, again, please be sure to reach out to our office and ask for Patricia. So next up, let's talk about Network Health's redesigned Anywhere PPO. Some exciting changes for next year for Network Health's Anywhere plan. We've been really looking forward to sharing this with you. As I mentioned earlier, Network Health is owned 100% by Froedtert. It is Froedtert's insurance plan. And as a result of that, Aurora doctors and facilities have been out of network, meaning higher copay amounts for Network Health Go members. For those of you who currently use Aurora, the Anywhere plan may be a great alternative for you. For those of you who currently have the Anywhere plan, you are going to see nothing but great changes next year. So let's dive right into it. The philosophy of the Anywhere plan is that you can go anywhere, meaning any doctor or hospital, and your copay will be exactly the same. Most PPO plans, including the Network Health Go plan, have a higher copay for going outside the network. That's what really makes this plan unique. As you'll see, the premium is dropping from $35 a month in 2023 all the way down to $0 a month in 2024. In addition to the premium dropping down to $0, sign up for Network Health Anywhere means it's going to reduce your Part B premium by $25 a month. That reduction will be reflected on your Social Security statement. The max amount of pocket is $3,800 regardless if you go in or out of network. Your hospital copay is a $275 copay per day, days 1 through 6, and days 7 and above are covered at 100%. Primary care doctor is a $0 copay, and the copay for specialists is $35, same as the Gold plan. So feel free to pause the slide and compare the two plans side by side before we move on to the extras. Let's continue on some of the extras that we hope you'll take advantage of. Again, you get an annual routine hearing exam and coverage for hearing aids, same as the Go plan. Now, one of the big differences you'll see between the Go and the Anywhere plan is in the dental coverage. On the Anywhere plan, your dental benefit increases up to $3,000 annually, but there's a big emphasis on using an in-network dentist. If you go out of network, you'll pay 80% of the cost. Going in-network, you get 100% coverage for preventive services such as cleanings, x-rays. Comprehensive services like crowns, bridges, and root canals, they're covered at 50% up to that maximum of $3,000. To see if your dentist is covered, please scan the QR code on the screen with your phone for a list of in-network dentists. For vision services, you get up to $350 towards eyeglasses or contacts through Network Health's preferred vendor, iMed. Silver Sneakers continues to be offered for this plan as well, and as a reminder, it's a free fitness membership at local gyms provided at no additional cost. To find out if your gym participates, visit silversneakers.com. There's also a quarterly over-the-counter benefit of $75 for things like vitamins, toothpaste, Band-Aids, and other items you have in your medicine cabinet. So this is a really interesting plan design that may work for some of you. Speaking of the medicine cabinet, let's talk about your prescription drug coverage with Network Health. You'll notice that the only difference in prescription drug coverage is the deductible amount. $195 on the Go plan and $250 on the Anywhere plan. The caveat to that is that the deductible applies to tiers 3, 4, and 5 on the Go plan, and only tiers 4 and 5 on the Anywhere plan. Now, as a reminder, tier 1s and tier 2s are your generic medications, tiers 3 and 4 are your brands, and tier 5 is your specialty drugs. Covered insulins continue to be a $35 copay, and vaccines are covered 100%. Hopefully you're taking advantage of the mail order service through Express Scripts. You can get a 90 to 100-day supply of both tier 1 and tier 2 medications at no charge. Mail order service is very easy to set up. You just call the number on the back of your card, or if you need any assistance, call our office and talk to one of our team members. So how does one choose between the Anywhere and the Go plan? Really, it boils down to a few simple things. Both plans are excellent options. The trade-off is that enrolling in the Anywhere plan gives you lower copays for out-of-network doctors and gives you more dental coverage if you use an in-network dentist, while the Go plan is great for those using in-network doctors with Ascension, Froedtert, and Pro Healthcare. But also want the flexibility of the Pick Your Perks benefit, which allows you to use that $1,525 reimbursement exactly how and where you want to use it. Chances are you're currently in the right plan, but if you would like advice on making that decision, we encourage you to talk it out with your agent. So let's talk about the factors you may want to consider in regards to your Medicare plan. One of the most important things, has your health significantly changed since the last time you spoke to your agent? Do you have any upcoming surgeries, new hospital system? Are you taking any new brand name medications you'd like us to review? And then we ask you, how was your experience with the plan? Any hiccups, any surprises? Just a reminder, your FHK agent works with every company. So if you've experienced any issues, please make your agent aware. If yes to any of these, the first step is to visit fhkinsurance.com/RX. It is a very simple form to fill out that will be directly sent to your agent to initiate a review. Now, for your convenience, we're hosting Network Health in-person meetings where we'll be discussing all of their plans. If this is something that you're interested in, hang on till the very end and we'll have those dates and locations posted. Maybe see you there. Just a reminder, the annual enrollment period timeline starts October 15th and goes until December 7th. If you do nothing during this time, your plan will automatically renew, so there is no enrollment form we need to fill out or action required. As we asked in our letter, please stay vigilant against the unsolicited phone calls you receive and the bombardment of television ads. These call centers are out of state, some are out of the country, and they know very little about the plans and hospital systems we have here in Wisconsin. Please know that your FHK agent is dedicated to making sure you're in the most suitable plan for the medications you take and the physicians you see. Since we represent every major and local plan in your area, your agent would be happy to review the Medicare plans with you. In closing, we hope you found this review helpful. Please keep in mind we have a large team of incredible staff backing up your agent. From claim support to customer service, we have you covered. From our family to yours, we wish you and your family a wonderful holiday season and new year, and thank you for allowing us to be your insurance resource. Stay well.